Welcome to our Women's Health podcast series. My name is Abigail Hole and I am a Communications Assistant at Bournemouth University. Through this podcast, I'll be speaking with members of the Centre for Midwifery and Women's Health to learn more about women's health and the amazing research being conducted by the centre. In this episode, I'll be speaking to Anna Marsh, a clinical academic midwife based between Bournemouth University and University College London Hospitals NHS Foundation Trust. Hi Anna, how are you today?
Hi, I'm so sorry I work for a hospital with such a long name. I'm very well, thank you. I'm joining you from my workplace, so I am in a labour room at the moment, but very, very pleased to be joining you.
Thought we would begin by talking about your studies and research background before discussing your role as a clinical academic midwife. Could you tell us a bit about your work with Bournemouth University and the Centre for Midwifery and Women's Health?
Yeah, for sure. I mean, I've been involved with Bournemouth University and the Centre for Midwifery and Women's Health for years now. I kind of met them a really long time ago. So I studied to be a midwife at Coventry University up in the Midlands. And part of my undergraduate degree, right at the end, we had to do a dissertation, which was like a literature review, and you could do it on whatever you wanted as long as it was related to midwifery and kind of birth and improving women's health. So I looked at the influence of television on women's expectations of birth, so looking at like Call the Midwife and One Born Every Minute and how that's affecting women's choices. And when I was looking at the literature, there was loads of literature done by Bournemouth University, so I kind of became really aware of them as a team. Just as I finished that piece of work, they put out a PhD programme looking exactly at that, which was looking at how television is affecting women's choices of birth. And I thought, blimey, I better go for it. I mean, I think I kind of knew I really needed to go and be a midwife, but I thought it was such a good opportunity and it was so interesting. I thought I'll sling an application and see what happens. Went and interviewed, met the team, didn't get it. However, they messaged me at the end and said, you didn't get it, go and be a midwife for a bit and then come back if you're still interested. We'd love to work with you in the future, which was so nice, it's so supportive that I did come back. So I came back a couple of years later and said, yeah, I fancy doing some research looking more at social media and the influences of that on women. And so I met up with Professor Vanora Hunley, who's my supervisor throughout this journey, and Professor Anne Luce, who's from the Media and Communications department, and we've been working together ever since, really.
So have you been there then slightly since the beginning of the Centre for Midwifery and Women's Health?
I think I met them in 2017, so quite a long time, 7 years of the centre. So yeah, I came in, I did a Masters of Research at Bournemouth University in the centre, started the work looking at social media and maternity, looked at how women are using it. And then I really realised that the focus needed to be on how midwives are using social media, or why we're not using social media. Because we have this whole kind of issue in maternity services that women are using social media for advice and guidance during pregnancy, but midwives aren't using it at all. And we're supposed to be advocates for women and information providers for women during pregnancy and birth. So I kind of got thinking about why midwives aren't using social media. And that's kind of now formed the pre-work of my master's, my pre-doctoral work. I've got an application in for some more funding to go on and do my PhD in the future, hopefully. So fingers crossed for that. I'll be continuing within the centre.
Because I come from a marketing background, so it's interesting for me because obviously social media marketing, that changes so quickly and it's changing rapidly all the time. So as you said, you've been with the centre for about 7 years now, and so your research into social media, has that kind of evolved over time?
Oh, absolutely. You're so right. And that's part of the problem, is that absolutely love the NHS. I'm a huge fan of it, but nothing happens that quickly. Change in practice is like a slow burn, and social media is not a slow burn. Social media evolves rapidly. You know, I've kept finding, so I'm the antenatal clinic sister, the midwife in charge of the antenatal clinic at the moment. And we keep finding that themes in women's questions are coming up. And if you get to the bottom of it, you realise that it's because someone has posted about it, a big celebrity or a big influencer has posted about something. And it directly impacts women's questions, their choices. And I think that's on a daily basis, let alone kind of anything big change that the NHS would do is a much slower timescale. So yes, it's very, very quickly evolving. I think even throughout my study, it's changed a lot. I started studying this pre-COVID and how people use social media across society, not even just within maternity services, I think has changed dramatically.
So in your recent journal, which we kind of just touched upon a bit about it, which is titled "It is Time for Healthcare Professionals to Engage with Social Media," and that's something we can link through to with the podcast, you spoke about how your social media has rapidly become a key source of advice and support for women during childbirth. What are the key advantages and disadvantages of that?
You're absolutely right. That was a piece that Professor Venora Hundley, Professor of Midwifery, wrote, which I co-wrote with her, which we looked at a few papers, but primarily one that looked at the role of influencers in a woman's pregnancy journey. So social media influencers. I honestly think there are so many advantages to women using social media for advice and guidance in pregnancy. I know that we're really quick to focus on the negatives there, and there's a lot of fear around people using social media for health advice, especially during pregnancy. But I think there's a lot of opportunity for us to reach women. We know that we're really bad at communication within maternity services. We keep having these shocking, damning reports that we are failing women in communication, and it's kind of leading to more negative outcomes for them and their babies because we are not communicating with them efficiently. But we still struggle to find new ways to communicate, and I think that social media could be one of them. At the moment, our main way of giving written information is by leaflets, and there was a big study 10 years ago that kind of demonstrated that it's not an effective way to inform pregnant people of kind of information. I think we need to be looking to things like social media. We also know that I think it's about 97 or 98% of people of childbearing age use social media. So it's a real place where people already are to provide them information. So yeah, I think there's definitely advantages that we can reach people a lot easier. And also it's free. We don't have to develop a new app. If we're already using an app that, is already in existence, like Facebook or Instagram, then it's free. But yeah, there's definitely disadvantages. And that's kind of what most of the research focuses around, is that there's lots of potential for miscommunication, for health inaccuracies or myths to be shared, which is why I think midwives have a real role in this. So we can't be in control of every conversation about birth on social media. However, if we were there as like this positive place that people could come for evidence-based information, a reliable, trusted source, I hope that would mean that people could come there or know that they have a safe place to go to rather than seeking their own advice or, I actually genuinely think that most of the conversation about birth on social media comes from a really positive place and people are really keen to share their experiences. But birth is such a complex kind of nuance, and what people want is such an individual choice that I think kind of making sure that people get evidence-based information is really important as well.
Have you noticed in the new generation of midwives who have graduated and finishing their training and now onboarded and starting out in work, my assumption is that they are more open to recommending the social media and other resources to the traditional leaflets that you've had. So does that create some conflict in work sometimes between different generations of what you should be recommending? Is it clear to you what you need to be recommending?
You're absolutely right. That's definitely what's happening. So the midwifery course used to be funded by the NHS. We got money, free tuition fees, and then you get a bit of like a grant to support you. And then that stopped about 6 or 7 years ago. So it then became a fee-paying course. And I think I know that really affected the demographic of a student midwife. So I think in that year before it changed, the average age of a student midwife was 27, and the year after, I think it was something like 19. The RCM did this big study looking at it. So the demographic of student midwives has certainly changed to a much younger population. And I think we also need to work in line with that, making sure that we are harnessing their skills and their kind of approach to work and the fact that they are so tech savvy and they have that expectation. So yeah, I think it's definitely something we need to harness. But you think, if you've got this tech expecting fluent generation, if we're not keeping up with them, you can understand the frustration and that they're not kind of communicating, I guess, in the way that they're familiar with or comfortable with. And we also need to remember that does reflect in the population of people that are giving birth as well. So this younger generation of people will be coming through the services and expecting us to be competent and communicate that way. So yeah, I completely agree. I think it will affect midwifery and the future of midwifery. But yes, the next part of that question of what is the right way is this huge loaded question that we don't really know the answer yet. So we know that there's potential for us to use social media really well as midwives as a way to communicate, but what that actually looks like in real life isn't quite so clear. How can I post on social media in a way that maintains privacy or that acts professionally, or all of those things? Is the logistics of that is quite different. So I'm hoping that will be an outcome of my future research, would be to kind of look at positives and the practical guidance. I think is hopefully going to be an output in the future.
And have you done any research into how communications are perceived? Is there a certain format such as video or audio for how trusted this information is received?
Yeah, it's really interesting. There's not much that's known, to be honest, which is quite worrying. But this influencer paper that came out did show that actually these people are considered well-respected sources. That may be because they are reputable in the fact they've got a lot of followers or they've got a big fan base, for example, but actually they were rarely healthcare professionals. It's definitely a hot topic that's kind of continually moving.
And was there anyone in particular, like what channels were you looking at as part of your research?
So I focused on Instagram. So I did a study looking at how midwives post about birth on Instagram across 4 countries, across the States, Australia, New Zealand and the UK. And I looked at how 5 popular midwives from there were posting on Instagram. It's really difficult because, as you say, it's such a fast-moving thing, isn't it? And the platform that people use it really changes, especially across the generations as well, you know. So people that are a little bit older might be more into Facebook, whereas the young generation are using TikTok or various other Snapchat, all of that. So it's kind of hard to incorporate all of that. But I focused on Instagram because at the time, Ofcom did a big report and Instagram featured in the top 3 favourite apps of each age group within childbearing age. It's a bit difficult, but I had to start somewhere. But yeah, it's also really interesting how people post differently on different apps. People are much more likely to post positive things on Instagram because it's pictures and video sharing and with a small bit of text, whereas on Facebook you're more likely to share a bit more of a mixture because you could just share a negative post, for example, like a status that's a bit more negative. And so that's really interesting. It's something I definitely didn't know about before. It's unlikely that you put a picture on Instagram of you looking sad with a negative sentiment. But yeah, so it's been very interesting. I thoroughly anticipate that if I continue this work, I'll be watching TikToks or probably even using social media platforms that don't exist at the moment because they do come through so quickly. Yeah, it's very interesting.
Yeah, it's really interesting to learn more about what your study was about. I thought we'd also talk about your current role as a clinical academic midwife. For anyone potentially listening to this who may be thinking about going down that career route, what does your day-to-day work involve?
Yeah, sure. I mean, I'm super passionate about being a clinical academic and I really think everybody should be one. But there's not really a thing within midwifery. So I don't think I even really knew what a clinical academic was before. And that is somebody that works clinically and also academically at the same time, often about the same thing, researching into an area that you're working in. I kind of fell into it by accident. I knew that I wanted to do academia or some learning or some research, but I didn't ever really want to step away from clinical entirely. I love being a midwife. I also love the opportunity to improve services, which for me is what research is. But I fundamentally, I love looking after women and I love looking after service users. I think it's a really nice way to do a little bit of both. For me, I did a really good way to get into it, and even just to see if you like it, is to do a small grant. Any midwife is able to apply for it. I did one with the Wellbeing of Women, which is a charity who provides funding for small grants for research, which was in collaboration with the Royal College of Midwives and the Burdett Trust for Nurses, so a couple of other big organisations within the profession. And for me, what that meant was that I said, I've got this idea. I don't really know where to start. I've got a few people together to have a think about it. And it bought me, so I think I was awarded £20,000 or something like that. And that was given to my work, which then paid for me to be released 1 or 2 days a week, which was really great. It just gave me the time to focus on the research. So 1 or 2 days a week, I would work from home or work from the library or from a cafe, wherever I wanted to work really, or in Bournemouth, if that's where I was going. And I would look at literature reviews or start thinking about what a research project could look like. And then the rest of the time in the week, I would be doing my normal clinical role. And then I did a National Institute of Health Research pre-doctoral clinical academic fellowship, basically a year where the hospital was paid to release me for a year to work on a application or my pre-PhD kind of study. So it's to work on an application for a PhD, which is what I've submitted. Within that, I had a year of continuing to research, so looking more into the area, developing my own kind of learning as well. So I did a couple of like media and communications courses just to kind of develop my understanding so that I'd be in a better position for this PhD if that's where I went. I then went to visit some really successful social media interventions. So the Ask a Midwife service, for example, is a really good example of midwives using social media in the North and Yorkshire. So that was really good. For me, it's a really nice way of developing your clinical skills as well as your academic skills. And I think it's the way that midwifery is going. The chief midwife has launched this strategy to get more midwives into being clinical academics, to develop our workforce and to make sure that that role is a bit more present moving forward. But yeah, it's a really nice way of dipping your toe in academia, but also keeping up your clinical skills.
Are there any key personal skills you can think of that for someone who is looking to work in maternity services you think are important to have?
Within maternity services, definitely you have to be compassionate, you have to be patient, you have to fundamentally love helping other people, I think is essential, really. I mean, I don't want to undermine all pregnant women by saying I help them all, like that pregnant women do a blooming good job of looking after themselves and pushing babies out, but it's such a pleasure to be part of that journey, and I think to really thrive off that environment. I think if you want to be a clinical academic, the key is really to believe in yourself and to know that everybody has the imposter syndrome and that that's completely normal, and just go for it and put yourself out there.
So in each podcast, I've been asking what conversations about women's health do you feel we need to be having more conversations that we're not currently talking enough about? Do you have a response to that question?
This whole project started off with kind of expectations of birth, and I think that's a really interesting one. I think culture, even when Call the Midwife was on, if you think about birth then, it was done largely in the home. You might hear someone next door giving birth, people had lots more children, communities were tighter, communities were closer. Birth was a bit more of a real life regular occurrence that was kind of not such a behind closed doors event. Whereas I think now birth is a behind closed doors event. It's not something we see so often. People go to the hospital to have a baby, or they may have a baby at home. It's very rare that they have a baby at home, and they only have far less children than before. And as a culture, we don't talk about birth that much. We don't talk about the kind of nitty gritty of birth. Birth is incredible, and watching it has been people going through some of the most empowering moments of their lives. But it comes through so many different shapes and forms. I've had some women having incredibly empowering births on the birth centre in a birthing pool, breathing their baby out without a drop of medication. And I've had people having equally empowering births who've had a planned elective caesarean section, and it's what birth looks like and how that is a personal choice and how we support and facilitate and empower women through different channels of birth, I think is such a really important topic that we're really not that good at talking about. And I think that that's making sure that woman is fully educated, knows what to expect, or has had a conversation with someone about birth. Most often, if a woman gives birth, it will be the first birth that she's ever attended. But often people don't talk about their birth. So how are we, as a culture, as a society, supporting women to prepare themselves for birth and to be ready for birth and to have a positive experience, whatever that looks like? We don't mind whether it's a caesarean or a vaginal birth in the pool. How do we support them to make the choices that they want to about birth without having ever had a baby before? How do they know what they want? And it's about that education, I guess, for women. But yeah, it's something we're not very good at, I would say, as a culture.
Yeah, I think your point about community is important, because I hear people say about how it takes community to raise a child, and with our current modern lifestyles, in some ways we've come apart from that community.
I also think we need to reconsider what community looks like. For me, my next thought is birth community is perhaps on social media. It's perhaps in your pocket on a phone. Do you know what I mean? Like, it's not that traditional model. I work in central London. I literally am opposite Euston Station. We have so many women that don't even have family in the UK, let alone neighbours that they know or anything. It's what community looks like, and the support that they provide doesn't have to be knowing everybody on your street and they'll pop round with dinner every night. I think we need to be more understanding and more accepting, and perhaps even more encouraging, that social media could be an answer to this problem. Talking about birth, showing people what birth looks like in a kind of healthy, positive way, informative way. I think perhaps social media is the future of community.
Well, thank you so much for joining me on this podcast.
Please join us in our next episode, where I'll be speaking to Rosie Harper, doctoral student and clinical specialist physiotherapist in pelvic health at University Hospitals Dorset, and Sally Shepherd, service lead for pelvic health physiotherapy, to discuss pelvic floor dysfunction. If in the meantime you'd like to find out more about the Research Centre, please visit the Bournemouth University website.